Okay, so this week we're doing in lab medication management. Kind of ties in with the mental health issues we talked about Tuesday, as well as home health and a lot of other areas where OTs are getting more and more into medication management. I know with home health in particular, they're expecting more and more from the OTs in terms of their understanding of medications and taking part in the whole medication management kind of process. We'll look at compliance, solutions, some cases, working within the team, medication assessment tool, which is really cool, good practical one, simple one to use. Okay, so compliance, this is kind of research-based. It's kind of good information to know. Consequences of poor compliance with medications, increased hospitalizations, poor health outcomes, mortality can be deadly if you mess up your meds, as we all know. Common issues with medications, compliance, forgetting is the obvious number one. Running out of the medications, they have an issue with getting them refilled. That runs into issues. Careless about their daily schedule, so they miss things. They mess things up a little bit. Poor health literacy. They don't understand what's on the pill bottle. They don't understand why they need to take the med, so they don't take it and kind of fall off the wagon a little bit. Most effective compliance interventions. These are the things that work the best to get clients to take their meds like they're supposed to. Individualized plan. This is what we do as OTs. Knowing the patient well, knowing what's going on with them very, very well. You can individualize the plan for them, make it work for them. That's the most successful intervention that there is. Education is always good. Why do I need to take this med? What is it doing for me? That sort of thing. Daily supports. The daughter coming in, the phone call, something to get them to take it, to remind them to take it, why they need to take it. And then motivational interviewing. We'll talk about what that means. Motivational interviewing, if those of you aren't familiar with that, can be really a key kind of strategy and technique for medication compliance. Motivational interviewing, what is that? Making the client feel like he or she is in control. Feel like they're making the decisions, even if you're kind of suggesting and kind of facilitating them in a way to make the right decisions. Having the client become aware of the issues with medication compliance. So they understand the consequences of not taking that med, what it's doing to their life, how it may impact their function, that sort of thing. Have the client set his or her goals for medication compliance. This connects with levels of change as well. Are they ready for it? That sort of thing. Avoid imposing strategies, regimen, as the external expert. Telling them what to do in a very strong, heavy-handed kind of manner can be counterintuitive. It can really kind of go the other way. They may do what you want them to do in the moment, but over the long haul, they're going to go right back to what they were doing before because they don't see the reason or the purpose for doing it the right way. Avoid dictating or strongly recommending. Emphasize what the client thinks. People convince themselves more than others do. You can get them to buy into it, so they're convinced, you've got it, versus telling them why they need to do it. Motivational interviewing. The aim is to listen to and understand patients' reasoning for their partial adherence. What's the reason why they're not? There's usually a reason why they're not adhering, in order to develop discrepancies between their thoughts and their behaviors. They're thinking this, but they're doing this. So they acknowledge change as an option. Use a lot of open-ended questions in motivational interviewing. Open-ended questions cannot be answered with a single word or phrase. For example, rather than asking, do you take your meds? Ask, how do you get on with taking your medications? How is that going? Reflective listening. The conversation can be continued and deepened by reflective statements that demonstrate you have understood the patient. The simplest level of these may be just paraphrasing the patient has said, but they may contain attempts to understand the meaning. So kind of paraphrasing, parroting what they're saying, and then getting at the meaning of what they're saying. Summarize, keep summarizing. And it's useful to periodically rephrase what the patient has said and provide some direction for the next part of the conversation. Affirmation. If the patient does decide to change their behavior, they'll need to feel confident to attempt it. You can help them increase morale in the session by making reference to a patient's strengths, motivations, intentions, progress, and past successes. Don't impose, but facilitate discussion about change. Resolve uncertainty by allowing clients to express their own will to change or not. Accept that their readiness to change will not be fixed, but variable, kind of fluid kind of thing. What is our role in medication management? We have a stronger and stronger role we're talking about. Usually the team, the nurse, the doctor is the ultimate final say on the meds. Obviously, the one who kind of correcting the med kind of compliance issues is the nurse. You're kind of working strongly with the nurse. Communication with the nurse is huge. What do? We set specific individualized plans for medication management. Talk about habits and routines. That's our thing, habits and routines. That's a huge part of compliance. Health literacy, education, remediation. Some of these issues we can get at as an OT. Maybe it's a fine motor thing. Educating the healthcare team as what we're seeing. Our view is unique. We're very unique. How we add to the team, and then strategies. We're really good at strategies, adaptive equipment, that sort of stuff. Medication reconciliation. What is that? It's the process of making sense of patient medications and resolving conflicts between different sources of information to minimize harm and maximize therapeutic effects. Are they taking their meds, basically? How compliant are they with it? Are their meds, do the medications jive up with the medication list? You have a medication list in the electronic medical record, and you'll see, are they taking, do they have what they need to have? Are they both kind of connected? Occupational therapists perform medication reconciliation by comparing the list or lists of meds obtained from the medical records with the client's report of meds, what they're taking, what they're supposed to be taking. A lot of times there's a discrepancy there. OTs work with prescribers and other team members to resolve discrepancies and promote a shared understanding of the medication regimens. OTs do not handle or give medications. It's a key thing. We never, ever give medications to the client. I'm not even big on touching the meds, having them doing all the touching. You can, like, say you're filling a med box and you want to see how well they do with the med box. You can do that. You work with a nurse and kind of get everybody's on the same page team-wise. But they're touching, they're doing it. And if they make an error, so, oh, you forgot this one, have them do it. Not that you can't touch the meds. Try to avoid touching them, and definitely never give them a medication to be sued for that. Drug regimen review. Drug regimen review is a review of all meds the patient is currently using in order to identify any potential adverse effects and drug reactions, including ineffective drug therapy, significant side effects, significant drug interactions, duplicate drugs, non-compliance with drug therapy. This isn't something OTs usually do, to be honest. This is usually the pharmacist, the nurse, the doctors doing this. But it's a good thing to be aware of. As you get in more and more into the meds, you become aware of what they do and don't do. They start to say they're getting dizzy, they can't do this or that. You can check out their meds and go to the pharmacist, go to the nurse and say, do they need to be all this? Is this interacting with this? Because all that information is there. I mean, you can just Google it, or it's usually in the EMR in some form. The drug regimen review is conducted in a face-to-face encounter with the client to determine whether the client is performing medication management consistent with the prescribed regimen. The regimen also lists the client's experience associated with the regimen, i.e. ineffective drug therapy and experience or side effects. Medication management overview. This is kind of the different steps as we look at, as we're assessing how well they're doing in that. Can they fill their pill box? Communicating with the prescriber, understanding the need for the meds, getting access to the pharmacy, communicating with the pharmacist, retrieving meds. Do they understand? Can they read the label, understand how to take the meds, side effects, why they're taking the meds? Can they take it? The physical act of taking it. They may not have the skills, the fine motor, whatever, to get the med, into their mouth, manipulate med containers, consume meds as directed, store safely, store in a pill box. Monitor. Remember consumed and missed meds, understand appropriate actions to take for negative side effects, sustain, continue meds for the appropriate amount of time, and then kind of monitor it, refilling it, repeat, that sort of thing. Kind of breaking it down now into the different parts of medication compliance. tactile issues. They're having problems feeling it. Low vision kind of stuff. Bumps, puffy paint. If you're familiar with puffy paint, it's cool stuff that gives you a little bump. Velcro, Dyson, anything with a little kind of tactile sensation to it. Contrast. Contrast can be very powerful. Sometimes I put black tape in the bottom of the pill box so they can see the white meds versus white against white. Large print. Pill box cards. Take a little index card, write it on there, whatever it is, Coumadin 2 times a day. So it's big and large, they can see that. Pill boxes come with large print. Paper cups are great, they can just pop it right into their mouth. Magnifiers, we get into magnifiers as OTs, that's kind of our thing. Fine motor, pill box, different kinds of pill boxes, depending on what they have for film art issues. Pop tops, you get those from pharmacists, those are easier to open. Talk to your pharmacist, communicate with your pharmacist, they have a lot of ideas. Pill bottle openers, exercises to build these skills up, third-party coordination activities. Pill cutters, different kinds of pill cutters, easier to use. Education is huge, what they are, what they're for, what to do if you have an interaction. Blood sugar and education. Diabetes, blood sugar education is huge around their levels and what they can and can't do, depending what the number is. Time-sensitive meds. It's like there's meds around, can't think of the name of it. It's a levodopa kind of derivative for Parkinson's disease that peaks. They're peaking on the med. They can do more. You want them to have the pain meds before you come, or maybe not when you come. Empowering the client to advocate. The pharmacist, the doctor, advocate for themselves. Cognition. This is another big one that OTs work with. Is the cognition deficit to the point at the level that you can still work with it, compensate, work around it, so they can do what they need to do. Standardized assessments. We're going to tackle one in the lab today. Track the improvements, understand limitations. They're great to kind of seeing how they're doing, educating. Organization. Discarding old meds. Reviewing where stored in the home. Organizing different ways. Ziploc bags, Tupperware. Putting time-sensitive meds to cued areas where to take them, like where they take their coffee in the morning maybe. If they have a system and it's working, don't mess with it. If it's broke, it's not broke, don't fix it. Calendars, how can they refill the pill box? All kinds of strategies around memory, working within the structure of their day, TV shows, meals. Checklists are great. Color-coded stickers. When to contact the pharmacist, visual cues around the house, having the family call, phone alarms, telehealth, talking pill boxes, and apps work really great. There's automatic dispensers. Some of them aren't cheap, but they can just automatically dispense the pills with their meal or something. Prepare for disruptions in routine. Things really fall apart sometimes on vacations or whatever. Family support is huge. The team is huge, probably more so than any other thing. Medication compliance, working with the nurse, understanding your role. We talked about timing of pain meds, Parkinson's meds, diet, educating the nurse on the limits of what the client can learn and do. This is kind of where we come in, our expertise. Nurses aren't really experts on cognition the way we are. Cognition, perception, all those kinds of things. You can give them a pretty good picture about what's realistic, what's not realistic. The nurse would really benefit from that, I think. Our roles with the care team, the family, medications which are high risk for falls, medications are things to be aware of. Lasix is a big one with toileting. It gets you running to the bathroom a lot, which can be a fall risk. Coumadin and shaving the bleeding. Coumadin's a blood thinner, that can be an issue. Dizziness, that sort of thing. Getting back on the education thing. Sometimes it's the OT's role to really inform the team that this is just not realistic, that they can do this on their own. They're going to need help, or they're not going to be able to, stay where they're staying, kind of thing. Electronic solutions, that's a bigger thing, all kinds of apps, electronic timers, electronic dispensers, telehealth, Bluetooth technology, all sorts of great stuff out there. Here's a popular one, a fun one, MediSafe. Tracks what you've taken. Can connect to once they open the pill box and tells whether they've taken it, but whether they've opened the pill box or not. the sense of whether they've taken it. It can connect directly to the pharmacist, directly to the doctor. It's education tips, a lot of cool stuff for that one. And then we're going to do these case studies in a minute and the labs. And here's next week. Okay, stop this.